Hi, welcome to Family Matters, the show where we're going to talk about issues of importance to families with young children. I'm Chloe Learey, the Executive Director of the Winston Prouty Center, and I'm really excited to start this forum to share information with families with young children because early childhood is such an important time in a child's life. By the age of 3, 80% of a child's brain is developed, and by the age of 5, 90% before they even get to kindergarten. So we felt like this was an important place to share information and offer resources to families with young children. And we're calling it Family Matters because we can't separate kids from their families, and you have to not only like young children, but you have to like working with adults too. So Family Matters, welcome to our first show. And we're going to start off by talking about the earliest stages of a child's life, the time when they're developing in the womb. So the state of Vermont actually offers services to families with young children 0 to 6, prenatal to 6, recognizing that if we want to give our kids the best start possible, we have to start thinking of them early. So today we are really excited to have Amanda Pizzollo join us. She is the Maternal Child Health Coordinator for the Vermont Department of Health and works closely with staff at Prouty who work with families with young children. We are fortunate to have such a great community partner, so thank you for joining us today. Thank you so much. And why don't we start with talking about what is a maternal child health coordinator?
Yeah, so, I kind of see it as two different avenues for my role. One is the coordinator piece. So I help connect all our community partners who are involved in improving the health care, specifically around maternal child health. Because just as you mentioned, the earlier we can start in someone's life, the more we can help hopefully improve it. And help our whole families. So I help connect hospitals, home visitors who see our families, and everyone else who's interested in the community. And then I also am really involved in the WIC clinic here because that's run through the Department of Health. So I see all the WIC prenatal clients.
And what does WIC stand for
Women's, Infants, and Children.
And that's a federal program.
It is, yes. Okay. So it provides supplemental nutrition, so supplemental food, which is how most folks have heard of us. And then it also provides nutrition education, so a lot of the kind of topics that we'll talk about today. And then again, it's a connection to other resources. So if someone's interested in a program like Children's Integrated Services, which is out of the Prouty, then we can connect them there.
Great, good. So why is this such an important time? Why are we worried about prenatal child development?
Yeah, well, just as you mentioned again before, if we can, improve care even during pregnancy, so as a child is forming, hopefully we can help improve their lives as well. And so during pregnancy, getting the right nutrition and everything can help with the baby's growth and development. It can also help prevent issues like preterm delivery, miscarriage. It can lower the risk of stillbirth and help both mom and baby be safer and healthier.
Great, good. It can be really challenging, when you're pregnant to feel like even eating anything sometimes or knowing, and there's a lot of information out there, and it's hard to know what to listen to. So one of the topics I know some people have wondered about is, do I really have to take this big, huge vitamin, right? Yes. So let's talk about prenatal vitamins.
Yeah. So prenatal vitamins are important. It's really hard, especially the folic acid, which is what people have heard of a lot. There is folate in food, which is the food version of folic acid, but we absorb the folic acid that we get in vitamins much more readily than we do folate in food. And when you're pregnant, your need for folate is 1.5 times the normal.
Wow.
So a lot of women, it's very difficult to get the right amount of folate. So the prenatal vitamin, that's one of the big things that it includes is folic acid and the right amount there. Also, iron is another really key nutrient during pregnancy, and it can be hard to get enough iron. Prenatals can also provide calcium, zinc, iodine, a lot of these nutrients that we need. So while it's great to really focus on getting nutrients from food and eating a healthful diet, having a prenatal vitamin, especially early on in pregnancy or even before you get pregnant, if you are of childbearing age, can be a really important thing to do.
And are some vitamins better than others in terms of quality?
Yeah, I will say, the gummy prenatal vitamins, even though they call themselves prenatal, they actually don't have any iron in them, which, as I mentioned, is a really key nutrient during this time. So if you're taking a gummy, maybe speak with your doctor. And see if a different option would be better. If it's because it's difficult to swallow a pill, because like you said, they're pretty big pills.
They're pretty big.
Yeah. Then you can talk to you can consider the Flintstones Complete multivitamin actually, which is chewable if you take 2 of those a day. That actually generally covers all that you need in supplementation. So,
that's good to know.
Yeah.
Flintstones.
Yeah,
Who
exactly.
knew?
Yeah. And then other than that, just always checking with your doctor too if you have any questions. And you can even bring one in if you're already taking one so they can run through the list. Or if you come into a WIC clinic, then we can check there too.
And I think you bring up a good point about how soon am I supposed to go see a practitioner when I get pregnant or if I think I'm pregnant, so that getting care early on is clear. I think people know to go at some point, but when are you really supposed to get there?
I always say the earlier the better, because it's such a big transition, and there's a lot to learn. There's a lot, just like you said, we get so much information that it's hard to really narrow it down and know what you need to know at what period. So early prenatal care can be really important, and it can also help, just like I was saying, how good nutrition during pregnancy can help, decrease the risk of pregnancy and increase healthier outcomes. Prenatal care as early as possible is certainly one of those things too. Even, again, if you're thinking about becoming pregnant, or if you're of childbearing age and you're not preventing pregnancy, then going to a doctor and talking about, we call it preconception planning now, can be a really good idea.
Planning.
Yep.
Good to know.
Yeah.
Some people, I think, are challenged. There's a lot of discussion, as we were talking about food, about like organic food, or how, are there any issues around organic food? And then that makes me think also, some people feel like they can't afford to eat healthily. Are there any resources that, you'd mentioned WIC, I don't know if there are more about WIC or other resources that people might want to know about?
Yeah. Well, yes, WIC is a great program, and we do try to, the food that we provide, we try to be as Vermont as possible, as local as possible, and we really try to focus on the needs at that time of development. And then other programs, there's food stamps through Economic Services here in Vermont, which can be a really helpful program. There's food shelves in the area, so there's local food resources too. I think the co-op even has a program called Food for All now that can be like 10% off your bills if you are receiving food stamps or you're a WIC client. So there's a lot of resources, and as maternal child health coordinator, if anybody wants to hear more, you can certainly give me a call and I can help with that. Yeah.
Good. So call Amanda at the health department if you have any questions about that.
Yeah.
And we'll give her her information at the end. Another thing that comes up when you think about food, I think we think about lots of cravings during pregnancy, ice cream, pickles, maybe together. Are there, in terms of, and then you think of weight gain, so how to sort of manage cravings and food and feeding too, and what are some of the guidelines people should be thinking about in terms of that?
Yeah. Well, in terms of the recommended weight gain during pregnancy too, it differs based on your height compared with your weight. So what we call the body mass index. So you can speak with your doctor about, for your body mass index, what would be the normal weight gain during pregnancy. If you're underweight, we want you to gain a little bit more than we would say if you're normal weight, or overweight. If you're overweight, we might want you to gain a little bit less than we would if you were underweight. And the other big thing too with weight gain is that you generally won't have much in the first trimester, especially with nausea and everything else. And then it's the second and third trimester where the weight gain, we want to see it pick up. And even if you are overweight, we don't want anybody to lose weight during pregnancy.
Okay.
Yeah.
That's good.
So just focusing on the right nutrients. You can still exercise during pregnancy, as long as you don't want to go skiing necessarily where you're going to fall, or
low impact
exercise. Exactly, low impact exercise. Yeah. And then just focusing on getting good nutrients in. You can definitely talk with your doctor or with us at the WIC clinic about what the recommended weight gain would be. Really, and you said eating for two. We hear that so often, and unfortunately, pregnancy is not a time where we can just eat whatever we want, which would be lovely. And we're not eating for two adults, we're really just eating for one and a little more. So to get like the right amount of calories in to get that right weight gain, you really don't need to add extra calories generally until the second and third trimester. You might want to add some extra little saltines or cold foods in to help with the nausea in the first trimester, but they generally say about 340 calories extra a day in the second trimester and 450 in the third, which
it's not that
isn't
much.
a whole lot. Yeah, it's like half a turkey sandwich and a glass of milk.
Wow, I
Yeah.
bet that's a surprise to some people.
Yeah, it is. Yeah.
Oh, that package of Oreos was not
Yeah.
not a good thing to
Yeah.
add. Another topic that is not nutritional necessarily, but people thinking about other substances that we have as adults in our society. I know, particularly drinking, I think that, you could probably go on the internet and find out lots of information about, is it safe to drink during pregnancy? I think we know that we assume that some of the harder substances, of course, I'm not going to, take heroin during not that we assume that, but I think alcohol is one of those substances that people have a lot of questions about. What can you share with us about that?
You're right, and we do get mixed messages about that sometimes too. So it's kind of good to clear the air. So just like with nutrition, you have to think everything that you take in during pregnancy is also getting to your baby too. And you're right, a lot of people, you think of the harder, alcohol is kind of part of our culture. So you think that the harder drugs per se, have more in effect, but really there's no safe amount of alcohol during pregnancy. There's so many different factors that can affect how alcohol is going to affect the baby. So there's fetal alcohol syndrome or fetal alcohol spectrum disorder, and it can also cause congenital defects. It can affect the development of the baby. But there's so many factors that go into it. It's not just the amount that you drink, it's also the timing, both, during pregnancy, even can be time of day potentially. So there's so many different factors going into it, genetic and not genetic, that really we haven't found any safe amount of alcohol. And then smoking is another big one.
Yes.
And it's hard to give up smoking. Smoking it can decrease the amount of blood flow to the placenta, so it can decrease the nutrients getting to the baby. So you could have a low birth weight baby, which can cause issues with maturity and development in general. It can also increase the risk of a preterm delivery and miscarriage. So it's tough to quit, but pregnancy is a great time to make a positive change for both you and your baby. And so there are a lot of programs out there now to help. There's 1-800-QUIT-NOW is the number you can call for the 802-QUITS program, or you can just search online for 802-QUITS, and there's tobacco cessation counselors who can help over the phone. They can even help you decide if nicotine replacement therapy, like the gums, that kind of thing, is a good option for you.
Is that safer than smoking? Like, are nicotine patches considered safe during pregnancy?
Well, nicotine patches, it is a steady flow of nicotine going to you, and so it can get to your baby, but it's something to talk about with your OB because it's always kind of a risk versus benefit. So you kind of said it just when you said, is that safer? And generally, if you can stop smoking, and you need the nicotine replacement therapy to do that, generally OBs will say that it is a good option because it can be safer than pregnancy. But I would always, and 802-QUITS too, if they're helping, they'll always want to reach out to your doctor as well and speak with them about it. And it could be something too. It's hard not to start again because a lot of people, you'll get motivated during pregnancy, and then it's hard in the postpartum period. You have a newborn baby at home. It's hard not to start again, but if you can stay quit, it's so great.
Yeah. But I was wondering if I think in terms of smoking rates in Vermont, I'm not sure where we are right now, but I thought we had pretty good statistics in terms of the level of people smoking compared nationally. So I think we've made some headway. But then I also thought, in talking with moms who have maybe gone back to smoking, how often do we have to try to quit? So it's not just a one-time thing sometimes for people.
Yeah, you're definitely right. It does. Most people, before they quit for good, it will take multiple attempts.
Yep.
So
keep trying.
Persistence is key. Yeah. And you're right, our smoking rates in general are lower, and most of our health indicators in Vermont are better compared to the rest of the nation, but we do actually have a higher rate of smoking during pregnancy than a lot of other states do. Yeah.
That's interesting.
Yeah.
Wonder why that is.
Yeah.
It's stressful. I mean, I think a lot of people that I know who've smoked or do smoke, there's something about stress. And as you pointed out, you have a new baby, you're tired. People see it as a way to sort of keep going. So, I can see why it's challenging, not just because it's physically addictive, but I think there's a mental addiction as well.
Yeah, absolutely. Habitual too.
And it's a habit, right?
Yeah.
Like, I just had my morning coffee, I think.
Yeah.
So think
I
that's
quit
it.
7 years ago, and
Oh,
yeah, it's not easy. but
congratulations.
it's so nice. I breathe easier
Yeah.
now. So yeah,
Yes.
it's definitely worth it.
Yeah.
It just takes persistence
Good.
and support too. You know.
Right, and I've heard some of those quit now ads and finding, if you ask, you have to change your patterns.
Yeah,
Go for
yeah.
a walk instead of having a cigarette, and maybe
Yeah.
find other people to hang out with sometimes.
Yeah,
not
exactly.
your drinking buddies.
Yeah,
because
walk towards
that's-
the non-smoking circle. If you walk towards the smoking circle, it can
So,
make it tough.
and what is the risk of low birth weight babies have associated risks? Like some people might say, they'll gain some weight, it'll be fine. But what are some of those challenges, or why is that a high risk?
Yeah. Well, generally with low birth weight babies, there might have been less nutrients getting to the baby,
Okay.
right? Hence the low birth weight. So it can cause some of the same issues that just poor nutrition in general can cause. Also, babies need that fat because, you think about it, they've been nice in the warm womb, the whole time. And they're out in the wide world. They don't know what's them and what's, the rest of the world. And suddenly they have to self-regulate their temperature. So having enough fat, is one of the big things too, and just being able to maintain the appropriate temperature. Yeah.
Good. I'm sure there are other health issues that come up during the prenatal time. Any other things that people should know about from your point of view, or that you can think of?
Yeah. I think nutrition-wise, we could all use some more fruits and veggies, probably. That's one of the easiest things, is getting more of that. Calcium, fiber, iron, protein, these are all really big nutritional things, nutrients that you want to look for when you're pregnant. And then just in general, there are complications that can come up. Gestational diabetes. We have increased insulin resistance during pregnancy. So gestational diabetes just means diabetes that happens during pregnancy. Pregnancy-induced hypertension, we used to call it preeclampsia, is when blood pressures can be high during pregnancy. So again, all of these are great reasons to have early prenatal care and have regular prenatal care. We have great obstetricians in the area, so we're really lucky in that way.
Yeah. So diabetes, gestational diabetes. What are there some people more at risk for it? How do you know if you have it? If you're worried about that, what are some of the symptoms?
Yeah. So one of you can be at higher risk for it if you're gaining more weight than in that recommended range during pregnancy, and oftentimes it will resolve after you deliver, if you have your baby, but you are more at risk for having type 2 diabetes later in life if you had gestational diabetes. And one of the big things with it too is with gestational diabetes, so insulin, like we said, it's increased insulin resistant, and insulin's what takes the sugar from your blood into your tissues and into your cells so that it can use it. So with gestational diabetes, more sugar is getting to the baby as well because there's more in the blood. And so you can have a large for gestational age baby. It's either low birth, you want just the right balance, right? Which can cause, increased risk of getting a C-section, so some issues with delivery just because of the size. And then the babies too will have gotten used to having higher sugars while they were in the womb. And so you kind of have to account for, and then they suddenly don't have all that, same amount of sugar going afterwards. So you kind of have to account for that. They usually check with your blood sugars around 24 to 28 weeks of pregnancy at the OB, and so that's the biggest way to find out.
Great.
But just a healthy diet, exercise can help prevent gestational diabetes, and keeping the weight gain within that recommended amount can really help prevent it too.
Good. In terms of, I think a topic we haven't covered is other over-the-counter remedies or things that you might want. So if to take during pregnancy. So for instance, some foods don't sit well with us when we're pregnant. Are there, what are some things people can do or feel, I'm sure checking in with your OB is a good thing to do, but are there things to avoid particularly over the counter or things that we know are probably okay?
Yeah. I would really say any medication or herbal supplement that you're taking to let your doctor know and to just discuss it with them one-on-one. Generally, some antacids like Tums are, safer to take during pregnancy. There are the medications that you definitely don't want to take during pregnancy. So there's so many medications out there that I would always have that discussion with your OB.
Just check in.
Yep, exactly.
Good to know. There's a program at the health department, I think, for oral health during pregnancy. Is that right? What is that program, and why does that matter?
So we have a public health dental hygienist here now, and she's really for helping our clients connect with dentists. It is tough. The Medicaid reimbursement rate for dentists is lower, and so finding a dentist who accepts Medicaid, and a lot of our WIC clients, that's their insurance, can be tough, can be challenging, and wait times at dentists can be pretty long. So oral health is so important during pregnancy, though, because, you think about it, any infection we get, like foodborne illness, or if we get sick, think how much more so that's affecting the baby, So if you have cavities or any infections in your mouth, that can affect the baby as well. And increase the risk, again, of miscarriage, preterm delivery, a lot of the complications that you don't want during pregnancy. So brushing and flossing really well is key, but then also getting to a dentist and having regular cleanings and exams. You can absolutely get fillings if you need to during pregnancy, so there's no risk in that. So yeah, if you're having a difficult time finding a dentist, especially if you're a WIC client, then give us a call and we can help with that.
Good. There's so much to worry about and think about.
yeah. But there's lots of positive things in a pregnancy too. One big positive thing.
Yes, there is you're right. It's a good time to be motivated because this is the base foundation for our kids getting the best start that they can get, and it's an important time to invest in. I think there are a lot of shoulds. I should eat better. I mean, we all know this. I shouldn't drink as much. I should eat better. And this time of life maybe is especially motivating for people. So, one last question, at least in terms of prenatal, is there anything you should absolutely not eat during pregnancy?
Yes. Yeah. So I know you're right. Everybody tells you there shoulds during pregnancy, right? So there are some foods to avoid. Foodborne illnesses, food poisoning in general, again, will have more of an effect on the baby. So making sure you don't eat raw or undercooked eggs, meat, fish, anything like that. And then also with deli meats and soft cheeses, there's a higher risk of listeriosis, which again is a foodborne illness. So with the deli meats or with hot dogs, just make sure you heat them to steaming, and that will kill any bacteria that's in the deli meat, and so it's safer to eat then. And we're not sure, listeriosis can be in deli meats and hot dogs at any time, but for some reason we're more at risk to contract it when we're pregnant. Yeah. And it'll make us feel like the flu, so it doesn't feel good for us, and it can really harm the baby as well. So, and then in terms of seafood, which is one of the things you'll hear a lot about in terms of eating during pregnancy, unfortunately there's mercury in our water now, so fish can have higher levels of mercury. So you do want to try to have lower mercury leveled fish that you're eating during pregnancy. So 2 servings of a lower mercury fish is fine. Generally, the white fish like cod, haddock can be lower in mercury. If you're going to get canned tuna, the light canned tuna is actually lower in mercury than the albacore or the white tuna.
Oh, okay.
So that's something to keep in mind. Crab is generally lower in mercury. So there's full lists online. Actually, if you go to the Vermont Department of Health website too, you can find the lower mercury versus higher mercury. Higher mercury fish of particular note are shark, swordfish, tilefish. So you want to avoid those during pregnancy.
Great.
Yeah.
We're probably not allowed, I guess, being landlocked in Vermont, we don't necessarily have a ton of seafood, but yeah, with world trade.
Yeah, and if you fish too, you can actually look online. A lot of the local ponds and lakes, we have their levels of mercury. You can find it on the Vermont Department of Health website. Yeah, good. So it's always something to check in on. Good.
That's wonderful. Thank you. Is there anything we haven't covered that you think people should know who are thinking about their prenatal health right now? Or any services that people should know about or resources? Yeah, well, I think another big one is just discomforts that you get during pregnancy. So we've kind of hinted about the nausea that's often especially prevalent in the first trimester.
And some ways to address that, like I said, having smaller frequent meals actually can be beneficial throughout pregnancy. Having some like some saltines or crackers or dry cereal when you first wake up in the morning if you're nauseated, if you're getting nauseated often, and then actually laying back down for another 20 minutes before you really get up and go can help. If you're having a tough time eating anything, really cold foods, they don't smell as strongly, and the smells can really cause nausea during pregnancy.
Yes.
So, you know, if your husband's cooking something that you don't like the smell of, you can tell him to stop. Or go take a walk maybe, you know. But, and then having the colder foods can sometimes be easier on your stomach too.
Good. That's very practical and helpful. Thank you.
And heartburn can happen later, but the smaller frequent meals can help with that. Trying to not bend over, you know, for about 30 minutes after you eat something. Depends on if you have any toddlers, I know. But acidic foods like tomato sauce, things like that can cause heartburn more. Greasy fried foods can cause heartburn more. So lots of tips. Like I said, you can always give me a call too.
Good, great. So where can people find you, Amanda? Why don't we hear your contact information if people have questions?
Yep, so I'm right at the Vermont Department of Health in downtown Brattleboro, where the WIC clinic is as well. And my direct line is 802-251-2102. And the main WIC number and health department number is 802-257-2880.
Wonderful. Thank you. Thank you so much for joining us today. We are excited to have this be our first issue of Family Matters, where we're going to talk about important issues for families with young children. And I'm Chloe Learey, the Executive Director of the Winston Prouty Center. Thanks for joining us.